our guests from near and far. Let me take this opportunity to say how proud I am and happy I am to see such a cross-section of people who are on the front line, locally, regionally, and globally, to ensure better health care, better health delivery. It's therefore my great pleasure to declare this summit officially open.
I want in a special way to extend my gratitude to the leadership in the Ministry of Health, Baylor Uganda, and our international partners, Pepper Johnson, Pharmaceutical NV, Ralph and Lewis, and the Cross-Sector Leadership Exchange for organizing this very important and wonderful summit.
Successful public health implementation depends on well-trained and motivated people, from frontline health workers who are the first to provide care or detect an anomaly that is the first sign of a disease outbreak, to the public health professionals who must collaborate to mobilize resources and organize a public health response. That's why I'm happy to be here at this inaugural International Summit on Leadership in Healthcare.
If we regard life as sacrosanct, that should drive us to be better leaders, but also better practitioners of health. So, using those principles, my vision, because again a good leader has a vision, is that the reason we lead for health is that we want a shared better future for all humanity.
And it's not just about discovering new technologies and drugs, but also how can we enable people and technology to accelerate our impact. And again, here leadership plays a very important role.
In this project, we wanted to improve viral coverage in the Rwenzori region. Viral is a very important aspect of monitoring patients on ART.
The Caring Together initiative, implemented in Eastern and Rwenzori regions in Uganda and whose lessons have convened us here today, could not be timelier. We've seen the impact in this region and the great results in HIV service scale-up and retention that I think is due in part to this leadership initiative that focused on practical ways to capacitate and motivate health workers at the local level.
And if everybody had a better life in Uganda, we would have a better country. And that's really why we lead. And in keeping with the motto of our country, I would like to end to say that we lead for God and my country.
This summit has underscored the importance of leadership in healthcare, especially as the most pivotal part of the 6 building blocks of health system strengthening. Without leadership, or without focusing on leadership, you cannot achieve all the other building blocks that we are working for.
Currently, the challenge we have is that leadership is on at the top, and we do not have leadership at the bottom, at the grassroots for that matter. And one of the key messages that we have learned in this workshop, the 2-day summit, is that collaboration and partnerships are key. Collaboration with the technical teams, with the political, with the administrative teams, to ensure that everybody embraces leadership for accountability.